All right. Today's Lunch and Learn session 15 is on yoga therapy for chronic pain with Dr. Rachel Bergmans. Really quickly, my name is Tiffany, and I'm a study coordinator at the Health Equity Corps. We are a group within the Chronic Pain and Fatigue Research Center that focuses on elevating the voices of patient communities in order to raise awareness about different health inequities and community needs. Together, myself, our director Rachel, and my project manager Vivian work together to bring events like this to the community. I'm here with Riley today, who will be helping me monitor the chat. For our online attendees, feel free to submit any questions that you might have in the chat or to use that raise your hand function to be unmuted and contribute to the group discussion. The Health Equity Corps is part of the Chronic Pain and Fatigue Research Center, or CPFRC for short. The CPFRC at the University of Michigan is a world-renowned research center composed of investigators and clinicians who study the mechanisms and most effective treatments for chronic pain and fatigue, including conditions that have chronic pain and fatigue as core symptoms. We aim to do a couple of things like improving the understanding and management of chronic pain conditions while also providing current evidence-based information to the public. We don't only study folks with diagnosed chronic pain conditions. Instead, we're interested in anyone at all experiencing chronic pain. And with that, please welcome Dr. Rachel Bergmans.
Thanks, Tiffany. I'll go ahead and share my screen. Okay. Is that viewing okay for you?
Yes, that's perfect.
Great. Welcome, everyone. So today we're here to talk about yoga for chronic pain. There you go. So the burden of chronic pain represents a significant public health problem. 50 million Americans, or 20%, which is also 1 in 5 people, report pain on most days or every day. Common locations of pain include the back, hips, feet, and knees. And then there's also specific diagnoses associated with experiencing chronic pain. So conditions like arthritis, fibromyalgia, lupus, sickle cell disease, and irritable bowel syndrome, or IBS. And chronic pain, it's invisible. You may not know if someone has chronic pain, and it can be significantly life limiting, associated with things like unemployment, social isolation, inability to engage with kind of daily activities. And getting to the next slide, actually, it's also, pain is also associated with several symptoms across the body. So things like fatigue, depression, migraines and headache, digestive problems and nausea, stiffness, tingling, and rash as well. So it can really be this whole body experience and in the ways that it affects people. On top of its burden for an individual, navigating pain care can be a significant challenge as well. So for one, there's gaps in pain education among physicians. They're not always familiar with all the types of treatments that will work best for each person. Surgery and painkillers may be the only treatments that people are offered for their pain. And people don't always have a provider who they like or trust to manage their pain symptoms. And with it being a chronic condition, it really does require coordinated care, great patient-provider relationships, and communication. And unfortunately, people will sometimes say this, will say it's all in your head, and they'll say it as a means of dismissing symptoms for individuals and not providing them adequate care or consultation around their pain. However, pain does originate in your head, and more specifically, the brain and the central nervous system, or the CNS. So the CNS, which includes the brain and your spinal cord, is the control center of the body. It processes and interprets signals from all parts of your body to help us respond appropriately to our environment around us. So for example, it processes information from our 5 senses, things like sight, hearing, taste, and touch. Another role of the brain and CNS is to detect and respond to potential harm or injury by processing pain signals. This is a term known as nociception. Normally, when the body experiences an injury or potential harm, pain signals are sent through the nervous system to alert us to it. like when you pull away from something hot or to avoid further injury. This is an important and life-saving function of our bodies. There are some individuals who are born with a congenital insensitivity to pain. So they don't have like a strong sense of pain or even touch at times, and it can be extremely dangerous, and it often causes death during childhood. So it is this important function that our brain is doing for us. However, sometimes the CNS itself can become overly sensitive. This is a situation known as central sensitization. It means that it starts amplifying pain signals or even generating pain without any apparent harm or damage to body tissues. It's as if the CNS has turned the volume up on your pain signals, making everyday sensations painful or uncomfortable. And that's also why sometimes people who have chronic pain may be more sensitive to things like light or sounds, or maybe more likely to get nauseous in responses to chemical fumes or perfumes, because it's all kind of linked around that CNS having this hypersensitivity around the senses. And so chronic stress or trauma can act as predictors of chronic pain by keeping the body in a constant state of fight or flight, which is a survival mechanism that can lead to heightened CNS sensitivity over time. This persistent activation primes the nervous system to be hyper responsive to stimuli, which can contribute to conditions involving this centralized sensitivity. So things like fibromyalgia or IBS. So in these cases, the CNS has turned up the volume on pain signals, making, again, those everyday sensations painful or uncomfortable. And so this process results in very real and often very debilitating pain for those affected. It shouldn't be dismissed as all in your head, meaning that, it's something that can just be turned off if you realize that. Even though traditional medical tests might not show an obvious source for the pain, that pain, again, it's real, it's still there. So understanding that the CNS can sometimes malfunction or become too sensitive helps explain why people experience pain in these situations. It's not imaginary. The nervous system is genuinely interpreting signals in a way that result in chronic pain. So treatment often requires this more comprehensive approach to help manage and modulate this hypersensitivity, aiming to reduce pain and improve quality of life. It's also possible for this type of chronic pain to exist alongside other types of pain mechanisms. So when there's an injury or inflammation and tissue damage. So therefore, approaches that calm this overactivity in the CNS and promote stress reduction can be beneficial for pain management. And that's what brings me to the topic of today's talk, which is why yoga offers one treatment approach potentially for treating this type of chronic pain. So what is yoga? Maybe I'll just pause, and if anyone in the room wants to call out, what do you think of when you hear the word yoga, or if you want to put something in the chat.
I think mindfulness.
Mindfulness.
Mm-hmm. You're concentrating on yourself.
Mm-hmm.
How are they stretching your body and your muscles, your bones?
Mm-hmm.
And breathing.
Breathing, definitely. Well, great, thank you. So yes, I would agree. Yoga encompasses all of those things and even more. And so I just want to take a step back and kind of visit, what is yoga's history and kind of what led to how we understand what it is today. So yoga actually has an ancient history. There's that picture on the slide to the far left. It kind of looks like a carving. So that's the Pashupati seal. And it's associated with the Indus Valley civilization, which was in the same region as modern day Pakistan. And it's as old as 2300 BCE. And it's thought to be the first known depiction of someone practicing yoga. So thousands and thousands of years ago. In terms of the United States, some of the first major introductions came in the late 1800s and early 1900s. So in 1893, an Indian Hindu monk named Swami Vivekananda attended the Parliament of the World's Religions in Chicago and delivered a speech that was considered very influential on Hindu philosophy. Later, Paramahansa Yoganand was a Hindu monk who immigrated to the US and published his book, Autobiography of a Yogi, in 1946. And this became a bestseller and profoundly influenced American perceptions of yoga and meditation. Around the same time, in 1947, a yoga teacher named Indra Devi opened a studio in Hollywood, California, offering classes to the public and celebrity clients. And so if you first heard about yoga because a celebrity you knew was practicing it, that's probably why, because it is really where one of the first major studios of yoga originated within the US. And then yoga also experienced a growth in popularity from the 1970s through the 1990s, which was related to cultural shifts towards peace, social justice, health, and wellness. And so where it stands today, there's this increasing appreciation for yoga's health benefits as a relaxation practice and form of physical activity within the American healthcare system. At this point, sometimes clinics are starting to integrate and refer yoga therapy for their patients to manage a range of conditions. There's also been a rapid expansion in the types of yoga that are offered. I've seen like goat yoga or like puppy yoga offered in some instances too. And so it's really kind of followed this transition, really covering like these very diverse aspects. So going back to that question of what is yoga, it can be an exercise class. For some, it's a spiritual or religious practice. For some, it's a practice of relaxation. For some, it's a lifestyle where not only are they maybe doing some of the yoga postures, but they're also thinking about the type of food they eat, how they interact with their world and interpersonal relationships. But why we're here today is that it can offer this multi-component approach for pain management. So one being that mindful relaxation, or what some people call meditation. Two being those physical postures and even potentially physical activity. And then those breathing exercises and that conscious stress reduction. And so yoga is known for having potentially several health benefits that people are studying. It's been associated with improvements in flexibility, muscle strength, and posture, as well as sleep duration and sleep quality. It can help reduce stress levels, anxiety, and depressive symptoms. Some findings show that it reduces inflammation. It's also been associated with changing structural changes in the brain that are responsible for pain processing. So potentially helping to address that malfunctioning of the CNS that can occur when there is chronic pain that's not due to an injury. And I want to dive a little bit deeper into some of the evidence behind the health benefits linked with yoga, just to give you a clearer picture of where some of like these health benefits that people talk about come from. And so investigators conducted a randomized controlled trial of yoga in rheumatoid arthritis. And so what a randomized controlled trial does is that people are randomly assigned either to a yoga intervention group or a control group. And in this case, it was just kind of maintaining their usual care. And having a control group in research is really helpful because then you know if the changes you see due to an intervention are because of more likely due to the intervention itself, as opposed to, sometimes people just start feeling better or they start feeling worse, regardless of what types of treatments they're taking when it comes to pain. And so in this study, 66 adults with rheumatoid arthritis participated. The yoga intervention was actually relatively high intensity, I'd say, in terms of duration. So it was a 90-minute yoga practice followed by a 30-minute lifestyle coaching session. And that was 5 days a week for 2 months. Personally, I'd love to be able to commit to something like that, but I know it's not always reasonable for people. But I will say in terms of health outcomes, they did note like a significant decrease in inflammation, as well as improvements in physical health, mental health, and social relationships. And so kind of showing kind of the value of this type of investment around pain management using yoga. And then I also wanted to pull a study that maybe had a more realistic duration of yoga intervention for most of us potentially. And so this was another randomized controlled trial, or RCT, of yoga among people who work manual labor jobs, or what's known as blue collar workers. And so that intervention was around 40 minutes a day, again, 5 days a week for 1 month. And then it was also followed by a self-directed or unsupervised yoga practice at home. And then again, the control group was usual care, so kind of no intervention beyond what they were already doing. And in this study, again, with that lower duration, they still observed reductions in pain, fatigue, and burnout, as well as improvements in flexibility, strength, and quality of life. And then I also wanted to share some of the evidence around yoga and brain structure. And so in this study, it wasn't a trial where they kind of were randomizing people to different types of treatment or a yoga intervention group. Instead, they recruited people who either had prior experience with yoga or had no yoga experience in the past. And then they compared their brain volume and their brain structure. And on average, the people who practiced yoga or had yoga experience had been doing it for at least 9 years. And then in terms of the outcomes, when they did these brain MRIs, it was the yoga practitioners who had greater gray matter volume in multiple brain regions and better cognitive scores. And then that volume was also associated with duration of yoga practice. So kind of suggesting that the longer you kind of commit to these types of practices, the more payoff there would be potentially for benefits to pain processing. And so bringing it back to the individual and, making yoga maybe work for you in your everyday life. Because yoga can be so many things, there's a lot of options for personalizing it or tailoring it based on what you're interested in or what your limitations are. So I like showing the comparison on the slide. I mean, sometimes when you ask that question, like, what do you think of when you think of yoga? It's like handstands, spandex, like sweating, hot. And yes, it can be that, but it can also be, taking a quiet moment in a corner of your room for 15 minutes and closing your eyes and going through some of the yoga-based breathing exercises. And so again, in terms of how much you want to be relying on relaxation techniques versus physical postures can be really modified. And even with those physical postures, there's so much variety and modifications that you can make or that a teacher can help you make so that you're finding like the right practice for you. And often the recommendation that you might get if you go to an average yoga class is like, if it feels weird, that's okay. If it feels hard, that's okay. But if it feels like a sharp pain or painful, that's when you want to back off, make a modification, or kind of try some other type of approach. And yoga, it can be practiced with or without music. It can be practiced as an individual or more class-based. It can be heated. So some classes are heated like 95 degrees or even up to 105 degrees. The reason that people enjoy that type of yoga is because it can help, one, increase the physical activity benefits of it because it maintains a higher heart rate. And so there's potentially people are burning more calories with that. It can also help people stretch more deeply without having to warm up as much. But then with that comes, caution around, for people who are maybe pregnant or if they have heart concerns, maybe that's not like the best fit for you. And then in terms of cost and equipment, again, there can be a big range there too. Obviously, there's very expensive memberships you can get at yoga studios, but you can also practice yoga online for free using YouTube videos in your pajamas. So there really is a big range, and there's a lot of entry points if you're interested in trying some of these practices for yourself. In terms of steps to starting safely, it's really recommended that if you're going to do any new type of physical activity, getting a physician consult or clearance can be helpful, especially if you have specific health concerns or comorbidities that you're unsure about. You could ask when you go to a class or are going to be maybe interested in working with a therapist, asking them about their training and experience. If they are a yoga teacher, they should have some level of certification or training, because that can just be really helpful in terms of them helping you make modifications, knowing what movements would or wouldn't be safe. And, sometimes you can go to a teacher before a class and say like, oh, like, I'm not comfortable like laying on my back. And so then they'll know to offer modifications during the class that would be otherwise. Certainly starting with breath work and more than mindful relaxation is an option if people don't want to be incorporating physical postures or movement. And then again, making modifications based on your preferences and limitations. In terms of resources for learning more after today, I mentioned YouTube videos. So Yoga with Adriene, if you search it on YouTube, offers like hundreds of videos that are long or short, like as short as even like 10 or 15 minutes that kind of walk you through a yoga practice. And so that can be one like really accessible way to try it. There certainly are local studios that you can find wherever you find kind of businesses, maybe on your phone or computer, and searching for like looking at reviews, looking at their class offerings and class descriptions on their website can be really helpful if it would be a good fit for you. And then there's also online subscriptions or apps. And so maybe that's like the middle tier of like free YouTube videos. Like there's no cost associated with that. And then local studios have maybe more expensive memberships. And again, this is tiered in terms of price. So then those online subscriptions or apps in terms of affordability would be right around the middle. And sometimes it's offered by local studios or again, like the app. But you just, I guess with those, you want to be more careful because you may not have a practitioner or teacher who can help you make those modifications. So yeah, to wrap it up, I guess a little bit, we've been offering a yoga therapy series once a month. These past few months, we have our last one in this series on May 3rd. But we do plan to have more yoga events coming up, both in the summer and hopefully the fall too. So keep an eye out for that. I do see a comment in the chat. Yeah. Oh, I see an endorsement of Adriene, another on YouTube. And then also Cassandra is very good. So something to look up if others aren't interested in that too. Thanks for that comment. And then I just want to close and say, pain management is not one size fits all. If you listen to this and we're like, absolutely not, like I'm just not going to do yoga. There are other types of pain management strategies. We talk about them a lot in these lunch and learns. And we've also kind of adapted some free web-based resources that talk about other types of strategy like acupressure or cannabis-based therapies. So we'd be happy to share resources about those too. And yeah, that's all I have. So thank you for your attention.